My question is directed at the Gambia. 1 in 4 households continues to struggle to meet their food needs in the Gambia, a situation that has persisted since 2022. What are the factors that are contributing to the high levels of food insecurity and malnutrition in your country?
Thank you for the correction. We have so many factors affecting food insecurity in the Gambia, socially, economically, and environmentally. And one of them is poverty. Over 53% of the Gambian population is poor. And also we have high cost of commodities and disruption of supply chain. These are factors affecting the food insecurity in the Gambia. We have imported products coming in really expensive, and factors affecting them are the COVID-19 and the Ukraine wars. These are factors that are affecting it. Also, we have post-harvest loss in our mangoes, in our oranges, and in our cashews. These have been, when they harvest, they are lost and thrown on the ground. They are not being preserved for future use. We don't have mechanisms to preserve these fruits in the future. So after rainfall or after they are being harvested, we lose them. And also we have climate viability. Gambia agriculture is mostly relying on rainfall. So sometimes the rain starts late and ends late. Sometimes it starts early and ends early. And other times during the rain, you will have a full week without rainfall. This causes dryness and affects the crops. And also we have you can have a 2 weeks long of rainfall. Rain is just pouring, and this can cause flooding, and this also affects crops. So these are factors affecting food insecurity in the Gambia.
Lack of domestic resources is one of the challenges that Liberia faces in funding its nutrition programs. Why is this a significant challenge to the extent that the team chose to address it as part of their participation in the Building Public Finance Capabilities for Nutrition program?
Liberia faces high risks of malnutrition, particularly among children and women. The current stunting rate in Liberia is 29.8%, which is very high. And Liberia is over-relying on donors' funding. Yes, there is no stable public investment planned for nutrition-specific interventions. And this is a problem because looking at our own priorities, looking at donors drawing down, especially USAID has drawn down, Liberia has lost pretty close to 300 million from the budget. And so it's about time that Liberia take ownership in the building public finance capability for nutrition is just right on time because it has equipped the team with the necessary tools and technical support in taking ownership as a country to combat nutrition and break the cycle of nutrition by creating a specific budget line for nutrition, specific interventions in the health budget. In that way, we will be able to have essential interventions like malnutrition, acute treatment for malnutrition, and also having supplementations for malnutrition that will keep our kids healthy.
We know for a fact that strong PFM systems are necessary to achieve national development goals. They boost fiscal performance and service delivery. To what extent is the Ghanaian government committed to food security? In other words, where does food security lie on the national agenda?
Thank you very much for the question. Public financial management system is a comprehensive framework that ensures government funds resources are put into optimal use. And Ghana's public financial management system is built on the 1992 Constitution and also the PFM Act 921, 2016. My government is really committed to food security, in that previous governments have made strides in achieving this. The recently gone government introduced various initiatives, like the Planting for Food and Jobs, Planting for Rearing and Jobs, and other initiatives that was boosting agriculture and also food security. Current administration has also initiated the Feed Ghana program and has allocated around 1.5 billion cedis into agriculture to boost, modernize agriculture, to enhance food security, and also to reduce imports. Currently, Ghana was spending around over 2 billion US dollars in importing foods annually. So with this, government is buying new equipment to support agriculture and also have improved seedlings and crops for the farmers. Government has also, we also have farmer centers at all districts in Ghana. Farmers go there to also get technical support and assistance in terms of the seedlings, improved seedlings to boost food security. For now, government has also introduced buffer stock program. Is there already, but government has allocated 100 million Ghana cedis to support food, to support the stabilization of food. So that is what Ghana has so far in securing that food is secured in Ghana, and also we have stabilization of food. In case there are shocks, we can respond to that.
So food security rests on four pillars: availability, access, utilization, and stability. Which pillar do you think has either been neglected and or prioritized enough, and why in your country?
Okay, I'll take this question. Yeah, since it's a follow-up on my earlier answered question. Food security, availability, access, utilization, and stability, I think they are all important. But what I realized is food accessibility, getting access to food, the economic and the physical access. I have had the opportunity to work with Ministry of Gender, Children and Social Protection. So I have been involved in most of these vulnerable issues surrounding the economy. Most children, even in some areas, have to go to school in order to get one nutritious meal per day from this school feeding program that is ongoing. Even though they grow crops, they have money for the sleep program to smoothen consumption, they are unable to get access to the nutritious meal. It's not easy getting them. So I think accessibility, getting the purchasing power to get this is very crucial, which we have really neglected. What I think must be done is to give them credit, getting access to credit in the local communities. As we even mentioned in our earlier submission yesterday, if they have credit, it will be easy for them to also boost their local economy. Also getting ready markets for their food crops that they have grown in their local area. It's difficult for people to even get there to buy those stuff. So those will be some solutions. And the availability, even though the food may be available, access to it is very difficult. So I'm of the view that accessibility is, and getting the purchasing power is also another issue and must be looked at. Thank you.
Nutrition requires a multi-sectoral approach. This is reflected in in one of the team's composition. Was it your first time working on this kind of group dynamic? How did cross-sectoral approach impact teamwork? And three, what collective strategy did the team apply throughout the journey?
I will take that question. Thank you. The multi-sectoral platform has brought together so many sectors like the health, agriculture, education, gender, finance, public works, and so forth. And it has enhanced teamwork, collaborations, accountability, of taking share ownership. Every member of the team came on board with expertise. Now, doing a multi-sectoral platform, it has come up with a cost plan where each sector will see which intervention to engage in, analyzing the national budget, seeing where to fit in exactly to combat malnutrition in the country. So the teamwork is enhancing collaboration and fostering national development for nutrition, and that the country will be able to take ownership. Right now, we have the secretariat seated at the highest level, which is in the Vice President office. And the team has meetings, meet on a regular basis to discuss issues concerning malnutrition and how to combat or break the cycle of malnutrition.
What are the key challenges that your team experienced while it was tackling the problem, and how did you address them? What would be your greatest takeaway from the program?
One of the main challenges our team faced was decisiveness and meeting with our authorizers, because we had several authorizers that were involved in our problem as the school feeding program, the Ministry of Finance, the Ministry of Basic Education. Meeting with these PSs have proven to be a challenge, and also their ideas and their decisions around the school feeding program was a huge challenge for us, as the permanent secretary for basic education wanted the school feeding program to extend the coverage, while the permanent secretary for Ministry of Finance wanted to improve the food quality of the school feeding program. So us as a team, being able to take in all these information and their different perspectives, bringing them in. So we had to sit in and discuss, take all the perspectives that came in, and continue to lobby more about where we want our solutions to get to, because we can't force them, so we just accept. Another thing is getting data from the right place has proven difficult, even with formal letters and direct walk-ins. So the strategy we used was mostly was direct walk-ins. We just call them and tell them that we are at your doorstep, and we get the data that we need from them. And also, the lessons I have learned from these challenges was teamwork, having the right composition of team individuals with committed and consistent attitude towards the problem. We are able to do so many things, have so many people on board to support us in our quest to increase food coverage, school feeding program coverage and quality. And also the PDIA, the problem-driven iterative adaptation. This is something that I have learned a lot from, having local problems and going step by step to try to solve them and also bringing on board people that are involved in the problem, because they will also help you when you are trying to tackle the solution. They will not be left out. I also learned that lobbying and my communication skills have been improved too. Interacting with these authorizers and interacting with the NAMs at the National Assembly has improved my communication skills, and also I am able to know that when you want to solve a problem, you can't do it forcefully. You have to have discussions, back-to-back meetings, and all that. So yeah, that's it.